Good day, everyone, and thank you for joining the second part as we move on to the part 2 of our unit CHCCCS041, that is Recognize the Body System. I will advise that you watch the first part in order to understand what we've covered. But today we are going to be starting with interpret the term relevant to the major body system. Using health-related terminologies and abbreviation relevant to the body system and understanding this will really play a very important part in our roles as a carer. So interpreting medical advice to our clients, whether during the referrals that we get probably from the doctor or even from other facilities, will really support our clients in making an informed decision about how to support themselves, and recognizing changes in physical, psychological as well as mental condition of our clients. It's one of the paramount things that we are expected to be vigilant and observant about on a daily basis. If we identify any issues with regards to our client's physical, psychological or mental condition, it is our responsibility, they call it duty of care, to report any such to our supervisor or follow the organization policies and procedure in reporting such. Interpreting content to implement client's individual plan and taking note of client's condition accurately without us familiarizing ourselves or understanding the terminologies as well as abbreviation use in regards to health-related body system. We might not be able to actually provide this information accurately. So, understanding this will, of course, make us be in the best position to support our clients in relating to their individual care plans. Some of the methodology or medical terminology that most of the time we are likely to encounter, or knowing this term will make it easier for you as a care worker or as a disability support worker in order to understand the body system related topics is as follows. Some of the terminologies include the sagittal plane or lateral plane. This is a vertical plane from front to the back that divides the body into the right and the left sides. If we saw any information that indicates median plane, a median plane is a just sagittal plane through the media of our body that divide it or any of its parts into the right and left halves. That is median plane. Coronal plane or frontal plane. These are vertical plane that divides the body into anterior and posterior portion that from side to side. Anterior and posterior is just saying from head to toe. That is the upper body and the lower body. Axial plane or transverse plane. These are horizontal plane that divide the body into upper and lower parts. Abrasion is when a wound caused by superficial damage to our skin and no deeper than the epidermis. So in case you have like like a small injury that doesn't really go in that far, and your skin and it affects the skin layer, but it doesn't really go in that far, that is what they refer to as aberration. Sometimes when you're working with elderly people, they might have a fall, and some of the top part of the skin might actually open, which most of the time they call it skin tear. So most of the skin tear that we have can be referred to these aberrations. Cardio or cardia, this has to do with the heart. Anything that pertains to the heart is they are referred to as cardio, and pathogens are infections agents or anything that can produce diseases. For example, the virus, the bacterium, and the fungus. Most of the time when you're working in the industry, they will ask you to actually go and get what they call flu vaccine. Flu vaccine is advised because of challenges associated with infectious agents, probably when we are sneezing or during the cold weather. Other than that, we also have some medical abbreviation relevant to the body system that often appear in some of the medical documents. Some of them include CBC, which is complete blood count. What is this? A blood count is a blood test that's used to assess the overall health and detect if there is any issue or if there is any disorder in someone's blood. UTI. The full meaning is urinary tract infection, and most of the time you'll see this when you're working with elderly people. You will see that they will advise that they actually drink water, particularly during dry season. Infections, UTI is an infection of one or more organs in the urinary tract, and if you want to dictate how this actually how to determine this, if your client is trying to go to toilet often or more like if they are even going to toilet like 3 or 4 times within an hour, if that is not normal, then they need to be checked for UTI. And sometimes the urine is actually so offensive when they actually pass it. These are some of the ways that we can dictate or we can understand that someone is having challenges with UTI. DX is most of the time the doctor will just indicate this, that is diagnosed. This is the process of identifying the diseases based on the signs and symptoms as well as tests that has been carried out. PX is prognosis, that is prediction of the outcome of the diseases, and URI also refer to a common cold, that is upper respiratory infection. This most of the time you can say it if you happen to be working with someone that is having challenges with breathing. They might be having challenges with URI. The cardiovascular related challenges that we are likely to be observing. So as a carer, your clients mostly probably maybe because of their elderly age or disability often experience various complications and challenges concerning their heart. And according to the government of Victoria Better Health Channel, cardiovascular diseases leading cause of death in Australia, with 41,849 reported deaths in 2018 alone. Just imagine, nearly 42,000 people died actually because of cardiovascular related diseases. So there are many factors why aging and disability clients are more prone to cardiovascular diseases. Some of these factors include the lack of physical activities, because most of the time, probably because of the disability or because of their aging, they don't really move around that much. And once the heart is not really working appropriately, then it's very hard for the heart to remain active. So that is why, as a allied health assistant, as a carer and as disability support worker, we should always think about how we can support our clients with their physical activities on a daily basis. Aging is one of the things, because the more you grow old, of course, most of the organs in the body, they also grow with us. So we should try as much as possible to engage them in an active manner. Stress as well as depression can also affect the way, or can also lead to cardiovascular issues. So try as much as possible not to think too much. Try as much as possible not to stress yourself. If you have any friend or any family or even your client that is going through any stress or depression, quickly raise the red flag and seek for the appropriate support if you can't really handle that situation. So the respiratory system is responsible for bringing in oxygen and taking out carbon dioxide through the lungs, the nose, as well as the mouth. Oxygen is brought into our blood through inhalation in the lungs, and carbon dioxide is brought out through exhalation. So that is the process of breathing out and the process of breathing in the air. So the air that we breathe in through our nose, where it is warmed, humid, and dust is trapped, this air goes through what we call the trachea into the right and the left bronchi. Then it travels down into the right and the left lungs. In there we have we have a small sac that is called alveoli. In this alveoli is where the oxygen is then exchanged and carbon dioxide is actually given out. The capillaries surrounding the alveolar sac are where the oxygen is exchanged for the carbon dioxide, and the diaphragm assists with breathing by drawing in here into our lungs and releasing or exhalation of air into the lungs as well. This diagram just gives us a quick understanding on how the air goes in from our nose, mouth, into the trachea, then straight into the left and the right lungs, and the last diagram down there is the diaphragm, which is a muscle that actually supports in bringing in this air and releasing the air when the oxygen has been absorbed and the carbon dioxide is about to leave our body. The next system we'll be looking at is the muscular skeletal system. This system is mainly responsible for giving structure and providing the body with the right amount of blood. And the muscular system, which facilitates movement as well as locomotion. So the muscular skeletal system consists of the bones, the muscles, the joints, the cartilage, the ligament, and the tendon. Ligament is a tissue that binds the bone to bone, and tendons are tissues that bind the bones to the muscles. So it is important to understand these terminologies when we are supporting our client. We need to keep them in mind regarding the structure and the location of any part of the skeletal system, for example, as shown below. So this is the skeletal diagram, and we can see the skull. It's actually the front and the back, which we call the anterior as well as the posterior view. So we can see the skull up to the toes. So understanding which bones and how each and every part of this skeleton in our body actually support us is very, very important. So please familiarize yourself with each and every bones in the body, and if any of your client is complaining about any part of their body, as we've seen in this diagram, we can just try to ask them few more information in order to know how to actually report it to our supervisor or the facility manager. Any question, guys? The next system we'll be talking about is the endocrine system. The endocrine system is a system that regulates growth, mood, digestion, metabolism, tissues function, as well as reproduction. We have just made a little bit talk about it when we are talking about the general system. So the endocrine system secretes hormones and transport secretes hormone transported to the organs via circulatory system. Below are some of the hormones and their functions. The pituitary gland is connected to the hypothalamus, which is another gland that oversees many functions in our body. The thyroid stimulation hormone stimulates metabolism, which is a chemical process within our cells. All these hormones, even the prolactin that secretes the breast milk, are hormones that that facilitate and support us in achieving or even in the growth when we are supporting or when we are actually in order for us to actually live as a complete person. There's a lot of people that are having challenge with different type of hormone, and this can be supported by another arms of the medical department, but our responsibility is just to make sure that we keep eye and report if we identify that our clients probably are not eating very well, or they are not using the toilet very well, because most of the time all this process and all this support or all this system are supported by different hormones. So if these hormones are not functional normally, or maybe they are declining because of the age, we should always take note of this and report it appropriately. And this is where we are going to stop today's class, and I will see you next time. Thank you for your time. Bye for now.